Welcome back. Hormones help our bodies in many ways, from digesting food to controlling our moods. So what can you do if your hormone levels are too low? Joining me now with the answers, Dr. Amy Lilie from BioHRT Natural Health and Wellness Center. It's good to see you, Dr. Lilie.
Thank you. Nice to be here.
And you have an office in Scottsdale. So you were saying that before it was in California, you've moved here so people can come directly to you.
Absolutely. We used to do more telephone consultations, and now we're focusing on the local population and offering all of our services so people can actually come in and meet us and we can talk face to face.
What are some of the common things that people might have or deficiencies they have where they would need hormones?
Well, it can occur at any age, a deficiency or an imbalance. We know a lot about women who have menopausal symptoms, hot flashes, night sweats, insomnia, anxiety, panic attacks. But women who are also younger, from when they first start having periods, could have a deficiency in progesterone, where they have a lot of PMS symptoms. And it's okay to take hormones when you're younger because there's no need to have all those PMS symptoms if you don't need to.
See, I think that's the misconception. A lot of people think, oh, it's just when I get older do I need them.
Right.
And then people get concerned about, oh, I've heard these stories, but these are bioidentical, correct?
Correct. There is a difference between bioidentical and some of the more synthetic hormones that we're more aware of. Bioidentical means that the chemical structure of the hormone exactly matches the chemical structure of that which your body makes. So your body recognizes it as self. So you don't have a lot of the side effects that you might otherwise have by taking the synthetic hormones.
And then how do you regulate it? By creams, by pills? What do people take?
Typically, I'll ask the patient what they most prefer, because depending on your lifestyle, you might not be able to put lotion on, or it might be more advantageous to do a drop under the tongue. And so you can actually put the hormones in many different forms. And it seems that the more people I see, it doesn't take a long time to really find the right formula. If you have done it long enough, you know that in the beginning you can give them a very low dose and they feel better right away. But the advantage of being able to use bioidenticals is that they're customizable. So if you are feeling a little bit more lethargic, if your hot flashes are 50% better but not 100% better, after 4 weeks I can say, well, take a little bit more.
So you can kind of balance it back and forth until you find
That's a great advantage of the bioidenticals.
The right. And I know you mentioned too that people who are younger, you think that, oh, I'm too young to start taking these. What are some other things that people might be experiencing that they just write off to, I don't know what it is, I have kids, I have memory loss, I feel lousy because I'm just too busy. Right. It's not necessarily those reasons. It's that you might actually need help with your hormones. And do you do a blood test to find out if that's truly what it is? Or?
Sometimes we'll do a blood test. We prefer to do saliva tests because your sex hormones like progesterone and estrogen and so forth, we like to look at the tissues to see what exactly are you absorbing of what you're taking in or what you're making. So when you look at the saliva, that's a tissue. So we can see more effectively what we need to do for you, what your deficiencies actually are.
I see. Yeah. And what other things do you, I know you do other things at your location too. What are some of the other
Sure. We have a wellness center where we focus on primary care medicine, just like if you went to see your general practitioner for a flu or an ear infection or hepatitis, you can come see us for lots of different types of natural therapies. But we do like to focus on hormone imbalance because so many people are suffering with that, and it's really not that difficult to fix.
And I don't think they realize they are. I don't think they realize. I think they just think it's part of aging, or it's, like I said, it's just part of life to feel lousy and tired all the time.
Right. It's very satisfying to talk to a woman who says to me, I have my life back. I used to have an invader in my body. Right. I don't know who I am anymore. And then after 4 weeks of taking a little bit of progesterone, they say, wow, I'm so grateful because I feel so much better.
Oh, that's good. So folks can come in and see you. And we have a picture of the Scottsdale location in case people want to know exactly where you are. They can come in and check it out. And there you are, basically. Where is that?
Well, that is about a block south of Shea on Hayden.
Oh, okay.
In North Scottsdale.
So people can get started just by coming in, making an appointment?
You can come into the office. You can look on our website, biohrt.com, and register. One of our patient care consultants will call you back right away. Perfect. You can call us on the phone. We're available to all.
All right. Thank you so much, Dr. Lilie. Very good information. And if you do want more information, as you just said, go to biohrt.com. There is the website right there, and there is the phone number. All right, coming up next, if parts of your body have lost their lift, there are options to give yourself a new look. We'll find out more about that when we come back.